In this episode, we will bring you winter fire safety tips from our fire department, talk about events organized by our Human Relations Department, and much more. Welcome back to your community. Join us as we give you information about our city services. During this time of year, we bring out our holiday lights, heaters, and put our culinary talents to work. That said, our fire department will bring you some winter safety tips. Our Human Relations Department has been hard at work with different community partners, one being Faith Health. We will speak with a team member with Faith Health and learn about community information and health services available to our citizens. We will hear from a young man about what is happening with the youth committee that works with our Human Relations Commission. Let's listen to what Reverend Francis Rivers has to say about the partnership with the city and the Faith Health Project. Reverend Rivers, Miss, can you give us your title at Baptist Hospital, please?
I have two titles. One is I'm a chaplain supervisor, and the other is that I'm the Hispanic Latino liaison for Faith Health North Carolina.
Now that you mention that, what is, let me give you the full name, Faith Health Community Health Assessed Mapping. What is that?
The asset mapping project began in South Africa during the AIDS epidemic, when public health folks were trying to figure out how to contain the epidemic, and began to realize that religious communities might actually be helpful in this rather than a problem. And so they developed an asset mapping way to identify what was in a community that could be helpful in terms of promoting the well-being of the community. And that got transferred then to Memphis, Tennessee, and developed further. And now Gary Gunderson and Teresa Cutts have moved here to Winston-Salem, and so we're using their technique to understand better the needs of the Hispanic Latino community here.
Today we're at the Southside Discount Pharmacy. We've chosen the Southside area because I do understand that this is one of your areas of mapping. Can you talk to us a little bit about what other areas have you chosen?
Basically, we've identified census tracts in the city where the highest number of charity care patients or self-pay patients live. And it's no surprise, it's the poorest parts of the city where there are the most vulnerable populations. So it's the East Winston, basically, and then here in Waughtown and in Old Town. And so there are 7 census tracts. And so we did a mapping here in order to better understand what was happening here in the Waughtown area.
Can you talk to me a little bit about why Dr. Freeman has chosen to come here to the Southside area?
It's a very deliberate choice on her part and that of her husband to be of service to the Hispanic Latino community, because access to medication sometimes can be a problem. And here they have the $4 formulary so that people, when they get prescriptions, have a good chance of being able to get them filled here at a reasonable cost.
And I understand that some workshops have already been taking place. How many of them have it been, and where?
We did 4 mapping events. One was with providers, that is people who offer services to the Hispanic Latino community. And that took place at Biotech Place. And we had about 20 to 30 people show up. And then we did 3 what we call seekers workshops, that is people who are seeking health care and other services. And we did one at St. Benedict de Moore in East Winston, and we did one at Buen Pastor Presbyterian Church in Old Town, and the one in Waughtown we did actually here in Southeast Plaza.
So there are 2 different types of workshops. One is for the provider. Exactly. And the other one for the seekers.
Right.
So what type of things are they that you discuss in each one of those?
With the providers, often people don't really even know that they're working in the same area, because sometimes things get so siloed. And so it's a chance, A, for people to get to know each other, and then to begin to talk about what's been successful as they seek to offer services and what's problematic. And with the seekers, it's much more grassroots. It's just what I call normal people. And we ask them to tell us about their neighborhoods, how they navigate the neighborhood, where are the places they go that they trust, who do they go to when they have questions or need advice. And we ask actually people literally to draw their neighborhood and tell us the story of the neighborhood and how they navigate it.
It's really interesting. Now, for the seekers, what challenges did they let you all know that they face in those communities?
There are two that are related. One is lack of a state-issued ID, and two, transportation. And so public transportation makes it very difficult, for example, to get to a doctor's appointment. So if people don't have insurance and are going to a free clinic, or if their kids have insurance and they're going to, say, the community care center, it can take all day if you rely on public transportation. If you get in a car and you don't have a license, then the Winston-Salem police and the sheriff have gotten better about not deporting people or putting them in detention, but it can still be a $250 fine, and if you're on a tight budget, that can blow a big hole in the budget. So one of the main concerns that people expressed was, would it be possible to get some kind of an ID that the Winston-Salem PD would recognize, so that they wouldn't have to be taken downtown and risk the possibility of getting put in detention and eventually deported. And they're doing that in Greensboro now. They're going to start doing that in Burlington and Alamance County. So we hope that something like that will be possible in Winston-Salem.
So then, with all of this said, what do you think are the things that the seekers or even the providers are looking forward as a next step?
I think there are a lot of free clinics in the city, safety net clinics we call them, and how to create more coordination among them so that they're not competing for limited funds, and also so that there's a better referral system back and forth between them. So another thing that emerged is that in Old Town, people have very difficult time accessing health care because there's really nothing there except maybe an urgent care or two. So the idea emerged of a wellness center that would be really all about prevention. So exercise, diet, some basic screenings that people could get to easily. And that would be staffed by people from the neighborhoods that people knew and trusted, so that if they did need to get referred to a clinic, we could arrange transportation with people who do have driver's licenses and take that risk away. So those are the things that are beginning to emerge, how to create more coordination in order to really increase the well-being and the health of the community.
Now, were the providers a little bit more specific onto other areas of town, what they see, what they perceive, or what they expect from those other areas?
Well, it was interesting. We realized that almost all the clinics and other things that are available, they're heavily concentrated in the western part of the city. So there really is, it's difficult in the eastern part of the city and here in Waughtown and in Old Town to access health care. So that was one thing, was how to reach areas that are clearly underserved. And the other thing was just the lament of the great difficulty in accessing behavioral health and substance abuse care for people, which are becoming increasing problems. Who knows all the reasons? Part of it is a lot of kids are growing up, both parents are out of the house working, and so they're home alone a lot. So the problems we all are aware of, teen pregnancy, substance abuse, depression, gang membership, those are the things that people felt that they haven't really been able to make an impact on.
So my next question, I think you've kind of gotten into it already. What other steps are there being looked at or in store for our community with this project of faith and health?
In Memphis, the way this worked is that a network was created of congregations and community organizations that could be available to help people understand that they had options other than hitting the emergency department. So finding the right door to access treatment. And then on the backside, when people were discharged from the hospital, the same network that could help make sure that people have transportation to a doctor's appointment, that they have food, that they have electricity, that they can pay their rent, that basically the things that they need so that they can actually recover and get well at home rather than keep returning to the hospital in this sort of endless cycle. And obviously the interest of the hospital is that brings costs down, but it's also the right thing to do to really create a safety net for our most vulnerable members of our community.
Now, Reverend Rivers, Miss, is there a way for other people in the community to participate of this project, to help out in some way or be part of this committee? How can they do this, and who do they need to call?
I'd be glad for them to call me, and I'm glad to give you my phone number.
And that is?
It's 716-4745. Someone will answer the phone saying this is Faith Health, and just ask to speak with me. And we can talk about how to participate. We're still trying to figure out how to build this. So I'm not inviting you into a structure that's already determined, but would be very interested to know if you're willing to help, what you can bring to the table, and what maybe you need that other people in the community may be able to provide.
As you heard, the Faith Health Project, together with the Human Relations Department, is working to get information out to our community. After our Did You Know segment, we will have Mr. Navarro, a firefighter with our Winston-Salem Fire Department, give us tips on winter fire safety.
Did you know? In January, the Winston-Salem Police Department and Special Olympics will host the 6th annual Polar Plunge to raise money for Special Olympics Forsyth County. Every winter, police officers and others jump into the freezing cold water of an outdoor pool to support Special Olympics. In its first 5 years, the Polar Plunge has raised more than $45,000 for Special Olympics. It is a great event for family, friends, and co-workers. Assemble a team and pick a theme and start raising money to be freezing for a reason. The Special Olympics Polar Plunge will be held Saturday, January the 24th at 1 p.m. at the Finnis Center at 861 Old Winston Road in Kernersville. For more information, contact Officer Claudia Morgan at 336-837-7151.
Mr. Navarro, can you please give us your full name and your title here at the fire department?
My name is David Navarro, and I'm a firefighter here with the city.
Let's start talking about general safety habits in a home.
General safety habits are, first of all, consist of checking your smoke detector, make sure the batteries are good in it, practicing safe etiquette within the kitchen, cooking, never leave your pots unattended when there's something on. Simple things like having an escape plan, just in case of an emergency.
Right. Now that you mentioned the kitchen, let's talk a little bit about safety in the kitchen. I understand, we have our stoves, and during these times, festive times, there's a lot of cooking going on.
Always.
What can you recommend to our community about safety in the kitchen?
Well, basically, as far as the kitchen goes, if you're ever cooking, never leave your pots unattended. Never say, yeah, I'm just going to go here for a quick second or there. I always try to stay with them until it's completely cooked and then turn it off before you leave the room, because, it only takes a few seconds for something to light off. And also, grease fires.
Yes.
It's always, you never want to put water on a grease fire. It'll spread the fire, it'll throw it everywhere, and it'll be, it'll catch everything else on fire. The best thing to do is put a lid on it, and it'll shut right off, or put a big enough towel over it that it'll smother it. But you never want to throw water on a grease fire.
Now, I also understand that there's something that you use under the hood that if fire hits it, it pops.
Yeah, it's a device that that you can, like you said, place over the hood where the vent goes, and like I said, when it reaches a certain temperature, it'll drop and it'll put whatever fire out.
Okay, now during these days, you know that the temperatures are going down. Okay, we're getting cold, and sometimes the heating system in the house or breaks down or doesn't work the way we want, and we start getting different types of heaters inside our homes. Can you talk to us about the different types of heaters and the ways we need to use them, and if there's any danger with them?
Yeah, and when it comes to heaters, it's always best to keep things 3 feet away from them. 3 feet away, anything that can catch fire. Even your fingers and toes. You want to keep 3 feet away from them. Around it, we have kerosene and we have electric. Electric being the more safer one. Kerosene, you'd have to, fill it up with kerosene. You risk spilling it and possibly catching something else on fire. So definitely, electric would be a better way to go. But yeah, kerosene works just as well.
Sometimes we tend to put them closer to a window.
Right.
But I think there's a danger of a curtain.
Correct.
How far away should we put it from things like that?
Any kind of any kind of material that'll catch fire. Again, 3 feet away is recommended around the whole heater itself.
We also have our festive time this year and during this time of year. So we tend to put lights outside, lights inside the house, our Christmas tree, and let's say our Christmas tree starts drying out. What can you recommend about all of these things that happen during the festive times?
Well, when it comes to a real tree, we always want to keep those watered, make sure there's no browning. They have a sap in it that's very, very flammable. It's always, like I said, best to keep it watered, make sure it's not drying out. It doesn't take much for them to catch fire at all.
And you know that sometimes the little lights that we use for the trees, you connect one to another, to another, to another. Is that correct? And then we put it in the wall? Or what device can we use for that not to happen?
Well, our plug-ins are a certain percentage of wattage they can only take. So it's always best to use a surge protector whenever you're plugging in multiple outlets. A surge protector has a little switch in it that it'll cut it from shutting down, from blowing your fuse and stuff. So definitely a surge protector is the best route to go when plugging in multiple devices, especially lights. There's also some that have timers on them. So let's say you want to, plug your lights in at night and then go to bed. It'll have the timer that'll cut it off by itself, cut the power to the actual protector, surge protector.
Great idea. Now, another thing that we talk about year in, year out, but we really do need for our public to understand the importance of them, and those are the smoke detectors. Can you talk to us about the importance of the smoke detector, and as well, let's talk also about the carbon monoxide detectors.
Okay. Smoke detectors, like again, these are our first lines of defense. Heat, what it does is smoke rises to the top, and these are the first things to catch it. Now, the best way to put them is on a roof and not on the sides of the wall. That being because when smoke rises, it starts to bank down, and when it banks down, it'll take it a while for it to reach the side. And if it's on top of the roof, it'll go right to it and advise you and tell you real quick that there's something there's something smoking. You want to check your batteries on these things at least twice a year. These right here, the best way to do that is with time change, whether it goes forward or goes back. That'll be your cue to change your batteries, in your smoke detector. And there's a way you can test them to see if the battery works. You got a little test button here. Goes off, means you're good to go. If it kind of gives a weak chirp, it means it's about time to change that battery.
Okay. Now, how many, let's say, how long do they last? Is it something that's every year I have to change the entire system, every 5 years, every 10? How long would something like this last?
You can change your smoke detectors every 10 years. Every 10 years is what their lifespan is.
Great. Now, talk to me about the carbon monoxide.
Okay, carbon monoxide smoke detectors, they have a combination, which is smoke and carbon monoxide. You can put those, again, up top. You also have your carbon monoxides that go into a plug-in. And what it is carbon monoxide tends to hover low. So wherever, like if it's a fireplace or like a kitchen where it's gas connected to it, you can plug in your carbon monoxide and it'll catch it if it's any carbon monoxide hovering around low. But they do have combination that are both, smoke and carbon monoxide.
Now, we're talking about carbon monoxide. What things will expel carbon monoxide?
Again, anything that's unburned fuel, like gas leaking from a fireplace, from a gas fireplace, or gas lines in your kitchen from your stove that could be leaking. Even stoves, uncooked material on stoves can release carbon monoxide.
Sometimes when it's really cold, some of our community will bring in a grill. Is that recommended?
Definitely not. A grill, again, has unburned fuel in it, and that is carbon monoxide, carbon dioxide. You're bringing that into your house, and again, it's always recommended that you never bring a grill or any of that type of heating device inside.
I've also read about a program that the fire department has in relation with the smoke detectors. Who qualifies for this type of program?
This program is available to senior citizens, also people with fixed incomes. They are able to call a number that we can give to you guys, and we can definitely go out there and install them ourselves, make sure that every room has one.
Okay. Now, we also have in our community people with hearing impairment. Is there any type of detector, something that could help and wake up a person that has hearing impairment?
Yes, there's special devices made for the hearing impaired, and those basically what they do is they have a kind of a light system that lights off. Also, where that potential person sleeps, they have like a vibrator alert that kind of advises them, hey, there's something going on.
Okay. Now, we also talk about there's a fire. Can you give some sort of way people can prepare themselves? Is there some way that we can learn about a plan that we have? Talk to us about that.
Okay, definitely. The best thing to have ready during an emergency or to practice for is an emergency action plan. And that basically is where you get together with the family members of your household and develop a plan for where to be and where to go in case of emergency like a fire or something does happen. The front yard is the perfect place for everybody to meet up at. It's just basically having something to go by just in case of emergency. So everybody's not everywhere. They kind of know what to do and where to go.
I've also heard about these ladders that you can throw from a second floor. How safe is that? Where do you get things like that?
Yeah, definitely. They make ladders for 2- and 3-story houses that you can just basically open your window and throw right out, climb down. And then I recommend getting those for like 12 and older. Someone that can climb a ladder without having risk about falling. Someone that can get up and get down a ladder easily. But they definitely do make them. You can make them yourself or sell them. They sell them at Lowe's Hardware.
Mr. Navarro, is there anything else you would like to let our public know during these festive days and cold temperature days?
Yeah, just basically have happy holidays, and if you ever need us, call us. We'll be there no matter what.
Please take these fire safety tips into consideration so you and our community can have a safe winter season. After our Did You Know segment, we will have Robert Ganzert, a recipient of the Human Relations Youth Award, to talk with us about his experience with the Human Relations Commission's Youth Advisory Council.
Hi, I'm Pedro Torres with the Winston-Salem Fire Department. Did you know the fire department has begun a door-to-door canvassing effort? Firefighters will distribute a fire safety door hanger to high-risk areas in the city and eventually cover all areas. The door hanger is printed in English and in Spanish and gives a wide variety of fire safety tips. Did you know that unattended cooking food is the leading cause for kitchen fires in Winston-Salem? Always stay in the kitchen when you are frying, grilling, or broiling food. If you leave the kitchen, turn off the stove. Did you know that space heaters need to be placed at least 3 feet away from any item that can burn? This includes furniture, curtains, paper, and clothing. Did you know that smoke detectors need to be tested monthly to ensure that they are working properly? Batteries should be changed twice a year, and smoke detectors that are more than 10 years old should be replaced.
Robert, can you give me your full name and what school do you attend?
I'm Robert Ganzert, and I attend Bishop McGinnis Catholic High School.
What is the council's mission?
It serves as a liaison between city government and the younger population, and its core focus is to focus on civic engagement and community programming and youth-oriented activities. And we as Youth Advisory Council members must serve at least 40 volunteer hours each school year to government-related activities or projects.
I also understand that you all went to a youth summit. When did it take place and where did that take place?
The Youth Advisory Council is a part of the Youth State Council, and there are 3 to 4 conferences a year, and it is hosted by various youth councils across the state. And the most recent one that Winston-Salem was involved in was the mini grant conference in Rocky Mount. And the next conference will be discussing leadership and team building, and it will be hosted by High Point.
That's really interesting, hon. Now, what topics were discussed?
The mini grant conferences focuses on reading and evaluating mini grant applications that were submitted by youth groups. And at the conference, they debate the projects and they make sure where to distribute the grant money throughout each council.
Now, I know you guys have what they call an annual project. What's that all about?
Our annual project this year is a series of commercials to aim towards the youth of our community, and we discuss topics such as labeling and getting somebody else to do something that is not the right thing to do. We hope this message will be clear to the younger members of our community.
Very good. As a recipient of the award of one of our banquets, the Human Relations banquets, what can you say about the banquet? What can you say? How did you get the award? Who qualifies for the award? Anything you could let us know about that?
The purpose of the Human Relations banquet is to recognize and encourage the youth of our community that demonstrate a positive attitude towards community service and volunteering, and accept relationships and diversity. And there are around 80 students are honored each year at the banquet, and they come from public and private schools. I came from St. Leo Catholic School, and I achieved this award through working with disabled children and starting a pet food drive at my school.
Great, and I also understand that there is an expression wall. What is that? What does a student have to do to participate in that?
The Youth Expression Wall is located at the Winston-Salem Square Park, and it is beside Milton Rhodes Arts Center. It's on Spruce Street. And the wall started a few years ago as one of the YAC annual projects, and after end of year celebrations is repainted each year, and the youth of our community can be there to express themselves in a positive manner.
That is really great. I know you all have so many activities and so many things that you're doing. Is there anything else you would like to tell our youth, the youth in our community, to help them and encourage them to participate of all these events?
Recently, we volunteered for the March of the Homeless Children, and we are currently trying to bring out and push out our work in our annual project this year. And we want to send a message to the youth of our city. And if you are in high school and you are interested in the Youth Advisory Council, then you may talk with your school counselor.
The Human Relations Department has been hard at work with many projects. Let's help the Human Relations Department by participating in committees and bringing suggestions to the table. For more information about committees, please call CityLink at 311 or by calling 727-8000. Also remember the safety tips that our fire department has shared with us today. I hope that you all have a safe holiday season with your family and loved ones. Safety should be our #1 concern, so we can all have a safe and happy holiday season. This is your host, Miriam Hernandez.